in terms of anger management, group therapy is done very frequently in the scientific literature when compared to individual therapy. And the important piece to remember is, first, there is scientific evidence that anger management works in a group setting. We've seen study after study that 4 different types of interventions in a group therapy situation actually do work. So we have cognitive restructuring that seems to work, we have relaxation training that works, and then we have skills training that involves assertive communication and problem solving. And then there have been a number of studies that have in fact combined different versions of those and all of them put together and shown that that also works. So therapists and clinicians have a lot of options in terms of picking interventions that actually do work. With that said, even though we do know that it works, it's very important that the clinician is trained in these scientific methods and has been supervised very well. Because we also know, for instance, when group therapy has been applied to populations who do seem to experience levels of high anger and aggression, like conduct disordered adolescents and things of that nature, they actually might get worse. What probably happens in those situations, and I've seen this when I was working with adolescents, is one will discuss how they were in fact brutalizing someone, and they'll be in fact reinforced for it by the other group members in fact applauding, cheering them along. And so we have 2 things happening. One, we have one patient who's in fact modeling the behavior that someone else might pick up, and 2, they're being encouraged and reinforced for it. So it's critical, one, that the clinician really knows what they're doing so they can make sure to curb any of those kinds of behaviors, and that they're really practicing the scientific methods that have been proven to work. Because we do know that oftentimes, even in pop psychology books, recommendations like venting anger and things of that nature are recommended, which there's lots of evidence that demonstrates might actually make anger worse, and it certainly makes aggression worse.